Hi, I'm Steve. Back here with Dr. Nario. Dr. Nario, thanks for being here again.
Thank you again.
Yeah, so today I want to ask some questions about testosterone. I know from spending time with you and being in your clinic that this is testosterone is important. It's an important hormone and it needs to be in the right, in the right space. So first, what is testosterone?
Good question, Steve. So that's one of the things that we've been seeing lately. All the men that's been coming in the clinic, they want to be boosted up. And testosterone is one of them. Testosterone is actually a steroid hormone, and this is responsible for the development of our male secondary sexual characteristics. These are the male hair growth, the beard, and sex organ development as we get older, and also the body structure, the muscular frame of men. And this is produced in the testicles. Also being used by women and is being made also in the ovaries of women. And adrenals, the adrenal glands, they also create this. And the peak of the creation of testosterone is always in puberty. And when we remember this, when we started to have changes in our teen days, we're shy about our body. We have body odor and hairy men becoming the teen wolf look. And these are the things that are normal. But the thing here is, those are the signs that our testosterone is coming into play. The decrease of testosterone starts at 40. Your blood testosterone decreases 1 point per year. And if it accelerated when you have stress, you have illness that goes along with your condition. And I see patients that are young as 30 that has lower testosterone from what they should be having. But this is mostly caused by ongoing stress that they have or ongoing illness. And right now, I just want to emphasize in our talk today that we're just going to be talking about testosterone in men. And we're going to have a different segment for testosterone with women because they also need it as well.
Okay, so are there some common signs that somebody might have that they potentially have low testosterone?
Yeah, so the common signs most of the time would be muscle mass. These are when you think or even objectively or subjectively see that the muscles that you have are shrinking. The flab bags in your arms, they look like flotation devices. And you're exercising and no muscle mass has been noticed, even with your rigorous gym exercises. Another one would be libido. When your libido is low, gone are the days when you're the sex machine for your partner, but you become the couch machine. Instead, eating chips and drinking beer is more of your preoccupation. And another one would be weak erections. When the flag was still up and now it's half mast. Even with all the pep talk that you're doing, it's not listening to you. And another one would be energy. Energy is when you're cartwheeling through life before, and now you're flat as a pancake. So just changes, all of these, as we see, can be correlated to the normal stage of aging. That's why other men that I see thought that, oh, it's normal, I don't have to address that, and it's just because I'm getting older. But if you think about it, these are easy problems to fix and can easily bring you back to your youthful self.
Wow, that's great. So is there anything that's maybe not so common or obvious that may be a sign of low testosterone?
Yes, Steve. The thing here is these are the ones that every patient should really understand, not the ones that I just mentioned, because those are just superficial signs of low testosterone. So not being aware of low testosterone is a big mistake for us. And just considering this as a normal stage of aging is really dangerous for the reason, number one, when you have low testosterone, cognition is getting affected. This is not when you left the stove on and the house was on fire. There are subtle things that you need to look out for, like where are my car keys? Or even the change. You cannot compute that in your head, how much you will really get. And another one is irritability. Irritability is not only happening in menopause for women. I know that wives out there are giving this stress to their husbands, but andropause, as we call it, also occurs in men when they become moody. Another one is osteoporosis. We always think of osteoporosis being only affiliated for women, but older men who suddenly had an unexplained fracture, maybe when you were playing basketball, you got hip checked, and you broke something that quick. It means that testosterone is deficient and your bones are not getting nourished. And lastly, the most important one would be when you have low testosterone, you have a higher chance of high risks of strokes and heart attacks. Usually we affiliate these diseases with high cholesterol and high blood pressure. But now the studies have been showing that low testosterone is one of the bigger causes why men have this.
Well, you're kind of making me realize that it's important. It's important to treat low testosterone, right?
Yes, definitely, Steve. And the thing here is all of the above that I mentioned, meaning all the symptoms that I mentioned, are important. It's just that weak erections would not give you that much needed home run when you're in the bed, and low muscle mass would make you look like a dried up prune, but it will not kill you. The thing here is the most important are the systemic illness that will increase the chance of death. And low T, again, as I've told you before, has been proven that you will have a higher chance of getting diabetes, hypertension, high cholesterol, strokes, and heart attacks.
Okay, so your clinic is biointegrative, and you can look that up online. So in the clinic, how do you treat low testosterone?
And that's a pretty good and common question that I get also. Not you're not going to get this treatment from your muscular buddy who is also trying to convince you about using a specific product from the internet, or the guy in the alleyway who's selling stuff in the trunk of his car, or the internet infomercials. None of these. The only way you can get proper treatment for this is through a medical professional. And this is a serious problem, which requires proper medical history, physical examination, laboratories, and not everybody would probably have this problem. But the thing here is you need careful evaluation. It might be the thyroid, it might be the adrenal glands, but one of the suspects will always be low testosterone. So with our patients, we always give them the options of doing oral, like tablets. We also do creams. We also do gels, injections, patches, and even pellets that gets inserted inside your body. It depends on the need of the patient, and this will be evaluated as we see you. And the thing that I just really want to tell everybody is that the problem is not treated in your shower room of your local gym or in your garage. It's an easy problem to treat if you're guided properly.
Okay, well, doctor, that's really good advice. Be safe with this. Make sure you talk to your physician, and you get a good game plan if you feel like you have low testosterone. So thanks for your time today, doctor, and we will see you next time.
Thanks, Steve.